Welcome to The Criminologist, the podcast dedicated to educating and entertaining our listeners. We bring you subject matter experts from around the world and share the latest and greatest evidence-based practices and interventions to help individuals desist from a life of crime and delinquency. This podcast avoids stereotypes and biases in favor of the lived experiences of those we can best learn from. Now, please welcome the host of The Criminologist, Joseph Arvidsson.
Hello, and welcome to episode 126 of The Criminologist podcast. Happy to have you all with us today. We are going to continue our series on profiling infamous serial killers with Dr. Jerrod Brown of Concordia University. Recall, this will now be the third part in this series. We have already profiled the cases of Albert Fish as well as H.H. Holmes. This week, Dr. Brown is going to continue with this series, and we are going to be taking a look at infamous serial killer John Wayne Gacy. Plenty of amazing content to get to in this episode. And so, because many of you may already be a little bit familiar with the case of John Wayne Gacy, and because Jerrod is going to be providing so much great content, I'm going to skip over even a light introduction of this case and leave that to Dr. Brown. I will tell you a little bit about this week's guest, lest you are new to the show. Again, Jerrod is a friend of the show and has been on multiple times in the past. I encourage you to go back and listen to all of his episodes, not just the one on this serial killer series, but a lot of the other great episodes he's done around ACEs, trauma work, neurocriminology. Check them all out. Jerrod Brown, PhD, is a professor, trainer, researcher, and consultant with multiple years of experience teaching collegiate courses. Jerrod has provided consultation services to a number of caregivers, professionals, and organizations pertaining to topics related to autism spectrum disorder, fetal alcohol spectrum disorder, confabulation, suggestibility, trauma and other life adversities, traumatic brain injury, as well as youth fire setting. Jerrod has also conducted numerous trainings for professionals and student audiences. He is also the founder and CEO of the American Institute for the Advancement of Forensic Studies and editor-in-chief of Forensic Scholars Today. Please enjoy my conversation with Dr. Jerrod Brown as he profiles the case of John Wayne Gacy. And I will see you all on the other side. Well, hello, Jerrod, and welcome back to the show. We are continuing our series on developing profiles or case files, if you will, around infamous serial killers. Before we dive into today's subject, Mr. John Wayne Gacy, why don't you go ahead, even though, Dr. Brown, you are a frequent contributor to the podcast, and we appreciate it. For those first-time or newer listeners, go ahead and introduce yourself to the audience, and then, again, we'll do an overview and begin that profile of John Wayne Gacy.
You bet, Joe. Thank you so much for allowing me back. Honored to be here, and hope all of you are doing well. My name's Jerrod. I am a professor, trainer, consultant, and researcher. I've been focusing a lot of my work really recently on the area of neurocriminology. And what I'm trying to do is really look through that lens when I'm digging into some of these cases. And if you're not familiar with the field of neurocriminology, obviously involves understanding the causes and contributing factors of criminality. If you're a probation officer, corrections officer, I'm sure you've had a lot of training in like basic criminology theory, but neurocriminology takes it a step further, in my opinion, where it is looking at prenatal trauma, behavioral genetics, biochemistry, the nervous system, all of the other factors that criminal justice professionals really look at when trying to understand criminal behavior, like family factors, social factors, looking at the R&R model, all very, very important. But then neurocriminology takes this other side that I don't think is really considered a lot. So if we're looking at like genetics, there's a lot going on with genetics research and some of these things that we've been talking about in these podcasts. Also really looking at the endocrine system and inflammation. And I really pay close attention to what's going on in the gut as well, that gut-brain health connection. So really taking it to a deeper level, because human behavior is complex and we really need a complex response to tackle these issues. And hopefully today you're going to walk away learning a whole bunch of new things where we're using John Wayne Gacy as kind of a case to dissect a lot of these things through that lens. But we're not sensationalizing these cases, really wanting this to be very educational. Obviously, you're going to learn about what he did, but then I'm going to take today's research literature and link back to some of the things that we know that were in his case history.
Outstanding, Jerrod. And thank you for that shout out on the emerging field, if you will, or area of study, if you will, around neurocriminology. I could not have said that better myself. And thank you. You did mention the risk needs responsivity approach, and that is clearly the bulk of what we do in corrections, which is to say adherence to those three principles. But to your point, and I just loved when you said this, human behavior is complex, and we need complex approaches. In my opinion, the reason that the risk needs responsivity model really took off, as it should have, was the field was somewhat in disarray, shall we say, after Robert Martinson's infamous 1974 proclamation that nothing works. And then thanks to a handful of gentlemen from Canada and elsewhere, we rallied around these risk need responsivity principles. But now, 40 or 50 years down the road, as you noted, Jerrod, I think we owe it to our stakeholders to give them the due diligence to begin looking at some of these other approaches, if you will. And neurocriminology is one of them. Again, looking at everything. And I just loved how you summarized this, Jerrod. Everything beginning with what's going on prenatal, the biosocial stuff, genetics. Again, sort of all of the above to address, as you said, this complex problem.
And I didn't mention nutrition. If people are bored one day, Google nutritional deficits, malnutrition, omega-3 fatty acid deficiency, excessive sugar consumption, and criminal behavior. There's a lot of articles out there. And I do think nutrition is another area to consider, or the lack thereof. So someone's not eating properly. Maybe they're sleep deprived. They're dealing with just very poor lifestyle habits. What role does that play in some of these cases? Tough to know, but if we're eating healthy, we're getting better sleep, we're taking care of our gut, we're taking care of our brain, our bodies work better. So this is good for any human being.
Let me ask, Jerrod, when you bring up nutrition, for example, I start thinking again through a practical lens. Does that perhaps have more of a setting, or is there more opportunities to look into those things for those practitioners dealing with juvenile clients?
There have been studies that have been done over the past several decades that have looked at nutritional interventions for juvenile offender populations as well as adult offender populations. And some of these studies are small, and it's hard to say, like, generalizing what they found. But I know there's a couple studies where when they help the individual significantly reduce their sugar intake, they noticed that problematic behaviors went down. And by no means am I saying that if you reduce your sugar intake, that's going to cure criminality, but it is one piece of the puzzle. I'm actually preparing to give a talk later this year on the topic of low-grade dehydration and its impact on brain and mental health. Not much with dehydration and criminality, but there's quite a bit on cognitive health and mental health. Just another fascinating area to consider that we don't think about. A lot of clients I've worked with over the years, they have not had water in decades. They drink pop, coffee. What factor does that play in their thinking and feeling and sleep abilities? Well, probably has something to do with it. And all of this is just general information. I always want to say this, Joe. Please talk to a qualified healthcare professional. Talk to a licensed nutritionist, a functional medicine specialist before implementing any of these strategies.
Yeah, could not agree more. And again, I can almost imagine my critics my fellow risk need responsivity champions. And again, I'm not saying we displace all that knowledge, but as you said, begin to take more of a holistic approach to these trajectories that our clients are on.
Why wouldn't we, Joe? That's the thing. Why wouldn't we take that holistic approach and stuff? Just knowing what we know today, just from what sleep does for us or the lack thereof, what stress does to us. Just really learning about that biopsychosocial approach, as well as the field of psychoneuroendocrine immunology. Big term, but if people just Google that and read a little bit about it, it'll blow your mind away. And I think it'll really change the way in which you look at why people do the things they do, why they have certain illnesses, diseases, deficits. It's really helped me have a better understanding and appreciation. And for the clients that continually come into contact with the criminal justice system, once I've looked through that lens, I've actually had more empathy for the individual. And it's really helped me approach situations in a different manner too, just for me personally and professionally.
We are in an age of discovery, Jerrod, and why not, again, leverage that information for the betterment of our clients and our stakeholders in our communities. So let's begin our overview of John Wayne Gacy. I'm going to turn it over to you for a little bit here, Jerrod. So as you said, we'll kick off with an overview, then look at some key points of Gacy's life. And then, as we always do when we profile these cases, take a look at some of today's literature and connect the dots maybe for some of the practitioners who can recognize some of the topics we're going to cover today by way of highlighting John Wayne Gacy. Take it away, my friend.
Thank you. So I'm sure most of you have heard of John Wayne Gacy, and there have been documentaries written about him. There have been plenty of articles and blog sites and different things you'll find on TV that have talked about his case. And again, I don't want to sensationalize anything that he's doing. I'm going to point out just some of the general variables, factors that were found in his upbringing, and then link it back to then what we know today from today's literature. But John Wayne Gacy was born in 1942, and he died in 1994. He died at the age of 51, and he was executed by lethal injection. He is known as one of the worst serial killers in American history. His dad was a World War I veteran and an auto mechanic. Just keep that in the back of your mind. World War I veteran. Obviously, if you study World War I, you know that was very horrific. And by all accounts, at least from my perspective, his father dealt with horrific types of trauma. His dad was extremely abusive to John Wayne Gacy. We'll talk about that. His mom, by all accounts, John Wayne Gacy had a pretty good relationship with his mom. Was she enabling at times? Maybe. We'll talk about that as well. He was the second of 3 children. The other 2 children, he had an older sister and he had a younger sister. They were raised Catholic. And most of you have probably, if you've studied him, he was known as the Killer Clown, but he had some other names too. I'll talk about that and why that is important for us to be aware of. If you look at different criminology sites, different articles on him, different books that have brought his name up, he's been referred to obviously as a serial killer, a serial rapist, an abductor, he strangled his victims, he tortured them, he drugged them, he gagged them with cloth, and some of them died of asphyxiation. He would shove underwear down the throats of some of his victims. He would stab some of his victims. Some reports bring up the fact that there was suspicion that he was engaging in necrophilia. Some reports, they just don't know. But there is some suspicion maybe he did that. But we know he did torture and kill several young men and teenage boys. I believe the final count of how many victims he has was about 33. So we want to take that into account as well. He was known again as the Killer Clown, Pogo the Clown, and Patches the Clown. Interestingly, there's a lot of video of him being interviewed in prison and things like that. So you can go online and actually watch different interviews with him when he was alive, obviously. He described Pogo the Clown as a happy clown. And he described Patches the Clown as a more serious character. So he kind of went in and out of kind of a happy approach to a very dark, deviant approach. On the outside, people liked him. People who knew him said he was a nice person, mild-mannered, likable. He was generous. But obviously he was living a very deviant lifestyle. On the outside, likable. Inside, very deviant, very destructive behaviors. Some people say, was he a true psychopath? I'll let everyone decide. I don't want to diagnose him here, but just take that into account as well. If we look at his earlier life, his early childhood history, what are some things we want to just remember with his case history? He had extensive trauma from his father. His father wanted him to be more masculine. John Wayne Gacy struggled with his sexuality for a long period of time. So that is a factor we want to take into account. So his dad wanted him to basically be more manly, supposedly. John Wayne Gacy dealt with a lot of medical issues throughout his life. Keep that in the back of your mind. This is a big thing we want to consider. I'll talk about that in a few minutes. So everything that I know about his history, his father was very abusive. He was an alcoholic. He was an unstable individual. Being a World War I veteran, was he dealing with trauma from the war? Maybe. Some of this stuff is speculation, but his actions indicate obviously he was dealing with a lot of untreated situations, and he would berate and humiliate and mistreat John Wayne Gacy. And there is some account, too, that his dad beat him so bad one time where it possibly caused a head injury. So keep that in the back of your mind as well. His dad died when John was in prison for an unrelated charge to a serial killing, but he was in prison incarcerated for a sexual-related offense. He always tried to seek his father's approval. It just never seemed like he was able to. And even after his father died, John Wayne Gacy still obviously loved his father and wanted his approval, but he never got that. So what factor did that play in as well? So we know now we have trauma history, head injury history, history of incarceration, history of grief and loss from his dad where he never was able to resolve the relationship. I don't think he ever felt liked or loved by his father. Did that factor into some attachment issues? Well, I personally think yes. So back to the medical. A lot of things going on with him medically. So at the age of 6, this is just, again, what I can find in all the reports and things that you'll find online and in books and documentaries. His father used a broomstick and beat him so bad that he lost consciousness at the age of 6. So what trauma did that do emotionally and physically? Probably a lot. When John was a teenager, he was hospitalized several times. And during some of these interviews that people did with John while he was in prison, he estimated that between the age of 14 and 18, he was hospitalized so many times, it really added up to about a year of his life during that time. So he was hospitalized for a long period of time as a teenager for medical related factors. At the age of 11, he was playing on the swing and got hit in the head by one of the swings. And from everything I've read on this incident the swing hit his head so hard it caused a blood clot in his head. And here's the tricky part with this. The accident at right around the age of 11 caused a blood clot in his brain, but it wasn't till the age of 16 that it was actually discovered. So he had that blood clot in his brain for several years, but during that time, he would complain and he would have headaches, but no one really discovered what was going on. At the age of 16, when they discovered the blood clot, he was prescribed medications that dissolved that blockage, and it seemed to make the blood clot go away. What factor did that have with this situation as well? So we have head trauma from a couple of situations. So we know that head trauma obviously is something we need to consider with this particular case. As he got a little older, at the age of 17, he was diagnosed with a non-specific heart kind of ailment as well. So he's hospitalized for that. And then other times through his life, he was hospitalized. He dealt with a lot of pain issues. He always seemed to struggle with weight. So we have a lot of things going on medically with him. What factor did this all play into his life? It's difficult to know, but we have a lot of layers here. With his high school experience, he had a lot of history of being bullied and teased. And for some of the reasons why was because of the fact he was dealing with some overweight issues and some other factors too. So we have a documented history of being bullied and teased, on top of the abuse he sustained from his father, on top of at least a couple head injuries and a lot of medical related issues as well. And he also struggled with sexuality and humiliation and rejection and some grief and loss issues. So hopefully your audience is starting to see there's a lot of things piling up here. And when we dissect these cases, we can never point to one cause. I don't know what the cause was, why he committed these crimes, but it's usually multifactorial and a lot of layers. I don't know anything about his prenatal history. That's another thing. With any case, you always want to dig into prenatal history. That plays into so many factors when we're looking at this through a criminal justice lens. He attended 4 different high schools, ended up dropping out before completing his senior year. And for a period of time, he cut off all contact with his family. What was going on then? Probably a lot of turmoil. So we need to take that into account as well. There is some account, too, that when he dropped out of school, he moved away. And for a period of time, he worked in a kind of like a funeral home setting as a mortuary assistant. So there was some suspicion that he was around, obviously, dead bodies. He was ended up being fired from this position because there was suspicion that he was just doing odd behavior and staring at the bodies for a long period of time. And just there was speculation maybe of necrophilia around that time, or at least some kind of thinking patterns around that. But during that time when he worked this job, he was shown how the bodies were embalmed and treated and cleaned. What factor did that play in to his kind of future behaviors? He was married twice. He had 2 biological children and 2 stepdaughters. When he was in Chicago again, this is where these crimes happen in the suburbs of Chicago, he was well liked. He put on different events for the community. He was respected in that community. I don't think anyone suspected for a period of time what was going on. But if they dug into his history, there was a problematic history before he ended up back in Chicago. He was convicted of other types of sexual related offenses as well. So there was a history there of just problematic behavior. Joe, I want to stop. Any thoughts, anything that you'd want to add about his case from your lens?
Well, I was going to comment, Jerrod, you're hitting on all of the usual suspects here, from trauma to the family issues with his father's mistreatment, the head injury. I was going to ask you, Jerrod, sort of a pop quiz here. Are you aware, I've seen the statistic on the number of individuals who are incarcerated who suffer from traumatic brain injury in this country?
You bet. So quite a few studies have now looked at that, and depending on the sample, 50, 60, 70% of people within prison settings have a history of head trauma. There have been a couple studies that have been done several decades ago where they looked at death row inmates. Small sample size for each study, but what they found was that 100% of each of the respondents and participants in each of those studies had a documented history of head trauma. If you're working with female offender populations, rates of head injury among female offenders are actually higher than male offenders. Why is that the case? Because of their extensive domestic violence history. If you're ever working in domestic violence treatment or supervision, if you don't look through a traumatic brain injury lens, you're missing so many things. And that's not just for survivors. Perpetrators of domestic violence also have a very high history of head injury. Why do you want to care about head injuries? Because if you're working with a client who has a history of head injury, that can impact their mood, their motivation, their memory. It can contribute to impulse control issues, higher levels of sleep problems, higher levels of being diagnosed with a co-occurring issue. It's very important to understand head trauma.
Which again, Jerrod, to the earlier point I was making as far as broadening our lens of not even formal assessment, but informal assessment, taking some of these crucial variables into account. TBI, for example, that is not on the radar of the vast majority of probation and parole officers in this country. But again, hearing those statistics, I'm trying to think of an analogy on the spot here. But I mean, imagine going into your healthcare provider and suddenly it's like, well, no, we don't take blood pressure type thing, or now we're not going to take your temperature. Again, the medical profession would say, wow, you're missing a huge piece of the pie here. I know, but we're doing these other things. But again, one of the many things we learn on this podcast is, again, we just owe it to our clients to continue to adopt these holistic approaches. So Jerrod, yeah, this is great. Continue on with some of these key points of John Wayne Gacy's life and keep connecting the dots as you're doing.
So I'll probably move into just kind of some of the literature now, but let's take a broad spectrum look at sexual homicide triggering factors in general. This is not necessarily related just to John Wayne Gacy, but what are some of the things you find in the sexual homicide literature that could trigger that person to actually going and committing a sexually based homicide? The research literature talks about the topic of isolation. So we need to look at, does the person feel socially isolated, excluded from society? Rejection can be a triggering event. If they feel rejected, are they acting this out or engaging in this behavior because of extreme anger as well, and they want to get back at society? Ridicule. If that person now as an adult is being ridiculed, teased, humiliated, and bullied too, is that a triggering event? In some cases, yes. Low self-esteem, substance misuse. So in John Wayne Gacy's history, from everything I've learned about his case, he did use alcohol at times and I believe marijuana as well. So did that play a role in any way? Fantasy development. If you study serial killers, especially sexually based serial killers, fantasy development is very common. So maybe somebody had these deviant, dark fantasies of engaging in these kind of problematic, concerning behaviors for many years prior to acting on them. What brought that fantasy to reality? What is that triggering event that actually brought their thinking about doing this to actually carrying it out? Difficult to say. Unresolved trauma, untreated psychiatric issues, looking at any other kinds of unresolved conflict or that person's inability to handle criticism. These are different variables that come up in the sexually homicide literature. As we move into just a few other variables too, I really want to look at this through a lens of interpersonal competence as well. He grew up, had a lot of history of humiliation, bullying, teasing. What was his level of interpersonal competence like? Some serial killers have higher levels of interpersonal functioning, others do not. So if we look through an interpersonal competence lens, think of the topics of social emotional intelligence. I think that's very, very important to take into account. What is his history of relationships like with other people? Friendship making ability, intimacy. Looking at this through the lens, again, you can apply this to really any case, but take into account their overall abilities in the area of interpersonal competence. How does the individual handle their own emotions? When emotions get tough, do they suppress them or can they name them and label them? How do they demonstrate empathy? Clearly, he had empathy-related problems, attachment issues, moral reasoning deficits. How did he handle conflict and how did he resolve conflict? Did he deal with a lot of repressed anger and resentment because of what happened with his dad and some of those other factors we spoke about? How was his personal versus professional life? By all accounts, he did have a number of different jobs and he was well liked at a lot of these jobs as well. But it's tough to know on a deep level, did he have higher levels of professional competence? How did he get along with coworkers? What is his self-esteem like? These are all things that factor into interpersonal competence. When we look at his case and many of these other cases we've profiled, I think it's important to also have at least a basic understanding of the topic of sexual sadism. You and I, when we did that profile training on Albert Fish, we talked about sexual sadism. If you're not familiar with the topic of sexual sadism, go to the DSM-5 and really take a look at what that says. But if someone is a true sexual sadist, really thinking about their sadistic sexual fantasies, their urges that really focus around being cruel to other people, thoughts of torturing people or actually acting on them, really they want to humiliate other people, dominate, control. There's some ritualistic behaviors or offense planning related to some of these kinds of behaviors as well. Now, I want to point out that obviously the overwhelming majority of people who have these features don't become serial killers. I don't want people to think that. If you're ever working with a client that has is diagnosed with sexual sadism or has these thinking patterns, the overwhelming majority never go on to do what John Wayne Gacy did. But there's a higher number of serial killers that do have these histories. If you look at some of the general literature related to sexually sadistic serial murders, some of the older literature points to the fact that obviously this is going to be much higher among males compared to females. The majority are Caucasian. Most had a job. So this is what some of the older literature says about sexually sadistic kind of serial killers. Paraphilias are very common, so very important when you study these topics to understand the topic of sexual paraphilias and criminal paraphilias. Again, most people that have a diagnosable paraphilia don't do these things, but a higher percentage of serial killers have these histories in their background. A high percentage of sexually sadistic serial murderers also have had a history of collecting violent kinds of material or images or pornography in their history has been very common. So really looking at some of that literature, very, very important. Humiliation has to be studied within this context. So what role did John Wayne Gacy's early childhood history of being humiliated himself factor in to when he engaged in these behaviors and he was humiliating his victims as well. Was he getting back at society? Was he trying to get back at people that wronged him early in life and taking this out on his victims? Something to consider as well. So to recap, Joe, where we're at, if we look at his history, early childhood trauma, attachment problems, harsh parenting practices by his father, history of rejection, humiliation, being bullied and teased, history of being shamed, history of head trauma, and clearly a history of moral reasoning and some empathy deficits that we know for sure. So those are things that really jump out at me with his case. Before I link this to kind of some of today's literature, anything else you want to add to that, Joe?
Well, thank you for pointing out, and you referenced both Albert Fish and perhaps H.H. Holmes, who we profiled not too long ago. First off, just a quick reminder to the listeners, if you are intrigued by this type of case studying of infamous serial killers, go back and check out those episodes that we did. And then I guess my question to you, Jerrod, you've done a good job of sort of talking about some of the themes here that you've seen with this population. Is there something that really jumps off the page for you, even if we just looked at these three individuals, Albert Fish, H.H. Holmes, and John Wayne Gacy, for example, traumatic brain injury, trauma, etc.?
Well, just the three that we profiled so far, every one of them has had trauma in their background extensively. So again, overwhelming majority of people that have had trauma do not do anything near this. But at least for the three cases we've looked at so far, that there's been trauma, and trauma from usually a variety of sources, and there's been a lot of loss in their background too. So how did that factor in here?
Right.
From two of the three we profiled so far, there's been head trauma. So Albert Fish had head trauma. H.H. Holmes, can't find anything to say that he had head trauma history. Don't know with that, but two of the three so far, I know we're going to be digging into multiple high-profile cases. So as we get into more and more cases, we might be able to come up with kind of similarities and differences between the cases. And each one of these serial killers is different as well. There's a lot of differences, especially with H.H. Holmes, a lot of difference with him and some of these other individuals as well. The motivation factors are sometimes different. Some are disorganized killers, some are organized. So the intent behind it, the motivation can be different. But in the end, they've caused a lot of harm to many people. And in these cases can wound a community for generations.
Exactly. Let's make that leap then, Jerrod, and take a look at some of today's literature.
Children who have grown up where they've lived in a home with extensive trauma and family dysfunction, again, most of the time, overwhelming majority of the time, don't do these things, but they may struggle with more distrust, more hostile thinking, more self-regulation problems. Obviously, these things can impact brain development because the brain obviously is rapidly developing at an early age. So if a child is exposed to lots of trauma and stress early on in life, that can have a negative impact on their brain and thinking and decision-making. It can contribute to increases in behavioral problems, hyperactivity, oppositional, defiant kinds of behavior. Kids that have grown up in very traumatic environments may have more social problems, so they may be more rejected by caregivers. It can sometimes erode their self-esteem and self-confidence and self-efficacy, to name a few. Higher numbers of children that have had extensive trauma when they get older, if they haven't had support and services in place, may be more likely to come into contact with the criminal justice system than kids that grew up in homes where there's a lot of love and stability and structure and warmth. So we need to consider the role of trauma. What about fear? You grow up in a home, a young kid, you can't escape the trauma because it's happening under your own roof. So what level does fear play into this? If you look at some of the literature related to trauma and fear, that can exacerbate anxiety and panic attacks and shock and panic and that feeling of hopelessness, helplessness, and fear. This can absolutely contribute to sleep problems and all kinds of issues, not just at home, but in day-to-day life. What happens if you're ever working with a client and they are experiencing trauma indirectly through emotional invalidation as well? What factors does emotional invalidation come into play here? Repeated invalidation over and over and over again can absolutely contribute to more internalized distress and feelings of being more self-critical, higher levels of shame. It can absolutely impact our self-esteem and our self-regulation abilities. And in some cases, it can contribute to that person engaging in more self-injurious and self-destructive behaviors as well. What about covert trauma? Maybe the trauma is not that visible, so it's more difficult to detect. What could be some examples of covert trauma? Well, emotional invalidation doesn't leave physical scars, but it can leave a lot of emotional scars. So being aware of like nonverbal kinds of cues, that could be covert trauma, where that lack of eye contact, or you can just feel from another person that they're disgusted with you. If a child grew up in a home and they felt like their parents always were disgusted with them, but never, the parents didn't engage in physical abuse, that can be a sign of covert trauma, where that child starts learning that they're just not likable or loved, and parents don't really like me. They don't want nothing to do with me. Favoring one sibling over the other. So just making those statements, why can't you be more like your brother or sister? And if that's being said to them over and over and over again, that's a type of covert trauma. What about abandonment for a period of time? Like the child is left home and the parents leave for days on end. That can be very terrifying for a child, obviously. Over-enmeshment. How does that factor in too? Where there's just that child is placed in maybe a friend role with the parent or an adult role, and now there's boundary issues and enmeshment and just lots of weird things around that. That parent-child kind of role reversal, where the parent or the child's thrusted into taking care of the parent or taking care of their siblings because the parent is not capable for some reason to do that. Minimization or reversing blame or causing someone to feel inferior over and over and over again. These are covert traumas that, it happens one or two times here and there. It's probably not going to have a lasting effect. But what happens if a child's growing up in a home and this has happened thousands of times over many years? You bet that's going to have an impact on that child as they get older. What about attachment problems? Obviously, attachment problems are more common in the criminal justice system. Neglect, abuse, abandonment, all of these things can cause attachment problems. A child thrusted into the child welfare arena, termination of parental rights, a parent who doesn't want to be a parent, and they really let that child know that you're a mistake, you weren't wanted or loved. I mean, there's a million things that can cause attachment problems based on what I talked about with John Wayne Gacy's history. How did his father's abuse factor into this? How did the bullying and teasing? How did being hospitalized for such an extended period of time during his teenage years factor into this as well? These are all factors that can directly or indirectly contribute to some attachment-related problems. With any case that I ever consult on, always ask yourself a couple questions. I think, did that client who you're working with have a history of never feeling valued or respected? What is their history of being rejected? Does that person feel shame or defective? Do they feel isolated or abandoned or ignored? These are all just good open-ended questions, I think, to consider with anyone you're working with. Because if that client has experienced many of those things, and they feel these things in the present, those are absolute barriers that can get in the way of that client being successful with whatever they're trying to do. A couple other things I think you want to consider, and when we examine these cases too, is how does the person cope with criticism, and how do they cope with rejection? When they get criticized, what happens? Do they go into full-blown rage? Do they go inward and start ruminating now and having these revengeful thoughts? Very important questions, I think, to consider. What about harsh parenting practices too? Again, almost everyone that's experienced harsh parenting practices does not grow up and commit these crimes that John Wayne Gacy did, but he did live in an environment where at least one of his caregivers engaged in harsh parenting practices. Harsh parenting practices can be lots of different situations and factors. So a parent who's extremely strict, overly authoritarian, uses fear-based approaches, a parent who's non-empathetic, has a tendency to shame their child, or uses threatening behavior verbally or non-verbally, has a tendency to criticize, has rage control issues, yells, screams, uses guilt for punishment, or physical threats as punishment. That's what the current day literature says about what are harsh parenting practices. What about rejection? Perceived rejection, too, needs to be taken into account. Rejection histories really are a form of trauma. And depending on the person you're working with, if they've had an extensive rejection history, that can erode their sense of self and their ability to handle and cope with criticism and stress. And as we mentioned before, with those sexual homicide triggering events, rejection has been discussed in that literature as a possible accelerant for some of these cases. So rejection histories need to be taken into account, and rejection histories in childhood, depending on who's doing it and the frequency of it, that can also erode one's attachment problems. Parental rejection. So we have rejection from kids at school, but what about parental rejection too? A mom or dad who consistently criticizes or minimizes their child or dismisses or ignores them, or just gives the impression to that child that they're always annoyed when that child's around. It's not going to be too long before that child starts believing that there's something wrong with them or defective, and they might go inward and avoid. They might have more anxiety. They might have more social skills. So a few things to think about with that. Joe, any thoughts before I move into shame?
No, this is great, Jerrod. Every time I interview you, I have a notebook to take side notes on to discover the next topic that I wish to go down the rabbit hole on. And I was fascinated and intrigued by everything you said around covert trauma. So that's going to be the homework I'm assigning myself. But go ahead and proceed, my good friend.
You bet. So the word shame really didn't come up when digging into his case history, but everything I look at with his history, obviously there's some level of shame there. He always wanted the approval of his dad. He could never deal with it. So when we think of shame, just obviously that's a toxic emotion. Looking at any history of just feeling defective, feeling worthless, feeling humiliated, just that lack of feeling appreciated by society. If we look at shame through a trauma or complex lens, obviously you start encompassing trauma and shame together. That can really erode our sense of self, and it can really make that person start fundamentally believing that they're defective, or they're worthless, or they're lazy, or they're toxic. It can also contribute to that person just never feeling like they have a sense of belonging to any particular group, or just any type of arena where they just don't feel like they belong, and they just always feel chronically misunderstood. So shame absolutely needs to be taken into account. If we look at the general shame literature, Shame can make people feel trapped, isolated, unlovable, defeated, just lots of self-blame. So shame is a very important area to consider when you're working with clients of any background. With his bullying history too, we just need to be aware, obviously, of that history of bullying. With the 3 cases we've examined so far, we know that Albert Fish was absolutely bullied and ridiculed in the institution he was in for a period of time. H.H. Holmes had a history of being bullied, and John Wayne Gacy had a history of being bullied. But again, almost everyone who's been bullied doesn't do these things. I had a history of being bullied in 3rd and 4th grade myself. Bullying, unfortunately, is very common. It can wreak havoc on that person's brain and body. And these are things, once the bullying stops, it doesn't mean their feelings stop around that. So just because you're working with a client who's an adult who hasn't been bullied in 20 years, maybe they're still dealing with some unresolved issues or grief or self-esteem or anxiety around that. So we really need to take into account bullying. And with his head trauma, so we know that a higher percentage of people in confinement settings have had head trauma. There are several documented cases of serial killers that have head trauma, but there are also several cases where someone engaged in serial killing where there's no documented history. So head trauma doesn't explain these cases per se, but it is one layer we need to consider. So depending on the type of head trauma, how often the head trauma happened. With John Wayne Gacy's case, we know at least 2 incidents of head trauma. And the blood clot, what role did that play with the blood clot in his brain and the lack of blood flow and circulation in his brain? Did that have any factor into this? When you think of head trauma, think of executive dysfunction. Did the head trauma have any impact on the frontal lobes? If there's frontal lobe dysfunction, that can impact someone's attention capabilities in some cases, their planning, their thinking, the way they problem solve. It can get in the way of flexible and adaptable thinking. It can contribute to more moral reasoning deficits, abstract reasoning issues. It can have a negative impact on empathy. We just don't know what impact it had, but general literature, look at some of the frontal lobe dysfunction, I think is very, very important. And I think one other area, Joe, I'll say before I kick it back to you is moral reasoning. Obviously, if you're engaging in these kind of behaviors, there's a level of moral reasoning deficits, empathy deficits. So very important to take that into account. If we look at moral development in general in children, and when things go right with moral development, kids develop a sense of right and wrong. They typically are in a home environment, a social environment, and have just an overall network or environment that's usually more calm and stable and peaceful. When we start thinking about how to teach kids moral development, obviously looking at that family system. Is that child living in a home environment where they feel loved and valued? Are parents modeling healthy, appropriate behavior? Or is that child growing up in a home where one or both caregivers is engaged in criminal activity? Is one or both caregivers abusing that child? So that's starting to fracture their moral development. They're confused. They see their caregiver doing these things. Their brain starts saying, well, this seems normal to me. As they get older, are they reinforced with other kinds of problematic behaviors or friendship groups? So these things, to really look at this through a moral development lens. I often give talks on the topic of theory of mind. And if you want to study moral development in a deeper level, look at some of the literature on theory of mind, which relates to perspective taking, study the topic of empathy, social cognition, executive function. Joe, if we ever did a talk on just moral development, that might be something we could go a lot deeper into, but that's a huge, huge thing. What are factors then, just in general, that can impact moral development empathy development. We know that people with higher levels of empathy, that's a protective factor. You're less likely to get in trouble with the law if you understand and use empathy and you have remorse. There's a higher percentage of people that come into contact with the criminal justice system, particularly longer-term offenders, that may have some deficits in that area. If you're working with clients with a diagnosis of antisocial personality disorder, conduct disorder, psychopathy, we know that empathy deficits are talked about in that literature, or people with callous and unemotional traits. These are things we want to consider. But what are some factors that can absolutely impact empathy development, moral development? Looking through a neurocriminological lens, what factors does genetics play into this, or neurodevelopment, so early brain development, but also prenatal development? Was the pregnancy free of drugs and alcohol, of toxins? Was mom eating healthy? Was she getting good prenatal care? So we really need to know what was going on during pregnancy. That has a factor in some of these things. What's the child's temperament like? There's a whole line of literature on temperament. So understanding temperament, personality development, that has a lot to do with it. Socialization abilities, social competence, being aware too. I don't want to get too far in the weeds today, but being aware, I would recommend your audience, if you want to know more about the empathy moral development, study the topic of mirror neurons or oxytocin. Oxytocin is a neurohormone that's been referred to as the attachment hormone or the cuddle hormone or the love hormone. Oxytocin is produced when you give someone a hug, when you're in a loving, kind, stable relationship. If a child's in a home and they're under great distress and fear and worry and being abused constantly, did that have a negative impact on neurochemicals, neurotransmitters? Probably on some level, I would assume. Thinking of the trauma history and the brain trauma. If someone had brain trauma, had extensive issues with executive function, frontal lobe impairment, those are things that can get in the way of empathy and moral development as well. So those are just a few things I think we want to consider through that moral development and empathy lens.
As you spoke, Jerrod, again, I'm taking copious notes, as I tend to do as a adult learner myself. Yes, theory of mind, a great topic for young learners or professionals looking to broaden their perspectives, to really go down the theory of mind stuff. And again, I would recommend framing that as you did, that it's really anchored in or grounded in, or takes a look at that perspective taking, which dovetails into a lot of the cognitive behavioral work that we're doing in corrections as well. And speaking of cognitive behavioral work, when you mentioned executive dysfunction, again, I would encourage all of my listeners, particularly those of you in corrections, to look at the role of executive function, or conversely, executive dysfunction, and the relationship that can have on our cognitive behavioral interventions, which we really embrace in our cognitive model. But again, not knowing about executive dysfunction puts us all behind the eight ball as far as where we should be as professionals. And then finally, Jerrod, you mentioned moral reasoning a few times, and I recall it's been quite a few years now, but I was trained in a facilitation that we do more with juveniles, a program known as ART, which I believe, forgive me folks, stands for Aggression Replacement Therapy. But moral reasoning was a component of that curricula that we taught the youth. So a little bit of overlap into corrections here and probation and parole, which is what we're all about. So I, again, thank you for pointing out those things, and then we can make that nexus to what we're doing.
Can I ask you a question about that?
100%.
So you brought the executive dysfunction. So some of these curriculums you're trained in, think about this. If the curriculum or the intervention that you're trained in requires a heavy reliance on asking clients like yes or no questions, or tell me why or how, like why'd you do these things, or why these played out. If someone had executive dysfunction, there's a higher chance that they had abstract reasoning deficits, which falls under the umbrella of executive dysfunction. So if you're asking clients how and why questions, or tell me why you think this way or why you did that, if you're asking them to go deep with introspection and self-awareness, the very nature of asking clients how and why questions as someone with profound executive function impairments and abstract reasoning can go over their head. They'll have a really hard time answering those questions. So when you do those things, utilizing approaches that are rooted in like coaching, modeling, teaching, role-playing, and making things visual and concrete might be more helpful, in my opinion.
Yeah, again, I could not agree more, and really encourage folks to look at that, particularly if you're delivering those CBIs, those cognitive behavioral interventions. Well, Dr. Brown, our library continues to grow here of this series on highlighting infamous serial killers to see what we can learn from their past. We now have our third installment in the books with John Wayne Gacy. And again, I encourage our listeners to go back and listen to the episodes we've done on H.H. Holmes as well as Albert Fish. Jerrod, I guess we haven't talked about it. I know we have an agreement, but we'll have to start thinking about who we'll highlight in our next installment of this series.
Yeah, I'm really leaning to Ted Bundy or Jeffrey Dahmer. Charles Manson, it's different than some of these other ones, but I definitely think I want to profile cases that people probably know some about, but maybe not to this deep of level with kind of the psychology, the neurobiopsychosocial considerations to take into account. So those are a few individuals that come to mind, but definitely if your audience is having any thoughts, questions, reach out to us. Give us some ideas on some other cases that we could profile, because our goal is to dig deeper into these cases and hopefully equip professionals with current day knowledge to help enhance the great work that you guys are already doing.
Yeah, I could not have said it better myself. It's really about using current day knowledge and using these past tragedies to maybe learn a little bit from them. And yes, as you said, listeners, if you've got a case you would like Dr. Brown to profile, please reach out to the show. I'll leave contact information for both myself, the show, and Dr. Brown in the show notes, as I always do. Dr. Jerrod Brown of Concordia University in St. Paul. Jerrod is also the CEO of the American Institute for the Advancement of Forensic Studies. I'll also leave a web link for APHIS there. As you can imagine, lots more resources if you want to learn more from Dr. Brown's amazing acumen on a variety of these topics. Jerrod, until next time, my friend, we thank you once again.
I truly appreciate you. Thank you, Joe.
A big Criminologist podcast thank you to friend of the program, Dr. Jerrod Brown. What I will do, if you are intrigued in particular with the other serial killers that Dr. Brown has profiled, I will leave those episode links for both Albert Fish and H.H. Holmes within the show notes of this podcast description. So you can just click on those links and go straight to it from there. But like I said, I encourage you to go back and explore some of the other outstanding contributions that Dr. Brown has made to this podcast. He is a wealth of knowledge. We will be back next week with a fresh episode. In the meantime, you may contact the show or reach out to us through our website, the Paragon Group, LLC.com, for training or presentations as to core correctional skills, implementation, or of course, the topic of desistance from crime. If you have questions or comments as to this podcast, feel free to contact the show via our email of thecriminologistpodcast@gmail.com. That's thecriminologistpodcast@gmail.com. Remember to follow us through our Facebook and Instagram pages at The Criminologist Podcast. New fun images are being added all the time to those feeds. You don't want to miss out. The Criminologist Media Group is also on Twitter. You can give us a follow at Crim Media Group. That's CRIM Media Group. You may also connect with me, Joseph Arvidsson, or Jerrod Brown on LinkedIn, and follow both the Criminologist podcast and the Paragon Group on our LinkedIn pages. Hey, lastly, if you've not already done so, check out and subscribe to our YouTube channel, The Criminologist, for additional content as to the themes of this program. Merchandise is now available. Visit our Paragon Group LLC.com website and look for the Shop tab to get access to coffee mugs, pens, and those Killer Diller Criminologist refrigerator magnets. And if you believe in what we're doing on the show, if you're part of the movement, please spread the word, tell a friend or a coworker or a colleague about us, ask them to subscribe, and do so yourself if you've not already done so. And always remember, folks, there's no them, there's only us.
50, 60, 70% of people within prison settings have a history of head trauma. There have been a couple studies that have been done several decades ago where they looked at death row inmates. Small sample size for each study, but what they found was that 100% of each of the respondents and participants in each of those studies had a documented history of head trauma.
The Criminologist podcast is a production of the Paragon Group, LLC. For speaking engagements, interviews, program design, or training opportunities, please visit us at theparagongroup.llc.com. If you enjoyed the show, you can find more content and videos on our YouTube channel, The Criminologist. Don't forget to like and subscribe. Both the Criminologist podcast and the Criminologist channel are brought to you by the Criminologist Media Group. Be sure to give us a 5-star review, and thanks for listening.